It was a Saturday afternoon. We was taking the grandkids back to their parents' house in Owensboro, and we had a vehicle accident. The oncoming driver came into our lane, hit us head on. In the Jeep, it was me, my wife, and we had 3 grandkids strapped in the back. First responders came, they got all the grandkids out, my wife got out. Everybody was fastened, safe, and everybody was in their seat belts, and all the grandkids was strapped in really good. I had 2 broken bones here, 2 broken bones here. So right now there's a titanium rod here. There's a titanium rod from my knee going down to my ankle. Sasha, that Saturday afternoon, she had her seatbelt on, and again, we was in that Jeep, but because of that head-on collision, her head still went forward. She must have slipped out of the seatbelt, like with her left side or something. So she had to have hit the airbags because she ended up with a concussion and whiplash.
And brain bleeds.
She had 2 brain bleeds. So she doesn't remember a whole lot from that accident or several days past that accident.
So goals for success for this couple include pain management for injuries, specific care for brain injury population, which includes the speech and language pathology with high level cognitive assessments, and also just working through the basics of activities of daily living, mobility with a new deficit. Ultimately, the goal is to work them to a safe environment to get home and to be able to function independently or together collaboratively independently, and then to continue to better themselves until they're at or near to the state that they were before their accident.
I'm just not a person that sits. I'm up moving around constantly. I've just got to go, go, go. And so for me, it was a challenge to be in a bed. And the people on the 4th floor, I think they picked up on some of that.
Yeah, they were motivated. They were, young, healthy prior to this. They wanted to get back to that lifestyle. They have a big family. They have lots of grandkids. They wanted to be available for them. So it was just very obvious that they were going to do whatever it was necessary to get through rehab, get better.
They definitely met me where I was. They came in and they really took the time to talk to me and to get to know me, and they talked to my family that was also in the room with me to know where I was before the accident, and they really worked hard to get me back to that spot.
Because Sasha had some different cognitive deficits going on, we had to think a little bit more about where she was and where she was comfortable with at the time and make adjustments to compensate for that. And so as we went on, her physical abilities were pretty good and we had to challenge her a lot more. So we incorporated the cognition into higher level tasks as well, just to push her a little bit more on the things that she needed some more help with.
Owensboro Health has a nationally recognized rehab program. Our staff is highly credentialed and highly motivated to get our patients back home and independent and to meet that patient's individual goals.
I just really am thankful that we both are here to do the things that we've done in the past, and that Steve is able to walk and move as much as he is. I know he says he's not back to normal yet, but thank God we're here and we're able to do these things. I would definitely want to tell the rehab team, thank you so much. Thank you for pouring into us, and thank you for being there when we needed you the most.